Good morning, friends. Welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. In the last few classes, we have seen the basics of infection control guidelines in Ayurveda. So today onwards, we will see detail of all the points which have been discussed so far. Now, one of the important treatment principle which is mentioned in the treatment of Graha Rogas in children, that is isolation of the child. We know that in all the infectious disorder, isolation of the patient or the case is the first line of treatment. So that has to be done so that he cannot spread the disease to others and other populations not get affected. So patient should be isolated. So we have seen many points regarding the same. Today we will see what Ayurveda explains regarding this. Graha Rogi, it is told that Graha Rogi should be kept in a separate room to prevent the spread of the infection. Graha Rogi should be kept in a separate room to prevent the spread of a infection. Now, this we know that this is the first line of treatment, and even so, this is also to say that why grahas are compared with the microorganisms. Okay, in the first series we have seen that Graha Rogas are nothing but microorganisms. The disease which is caused by the microorganism is nothing but infectious disorders. Now, in the infectious disorder, the first line of treatment is isolation, and Ayurveda also says that isolation is the first line of treatment. Okay, so now here Ayurveda says that entry into the room should be restricted. He says that in the classics it is told that the room where the Graha Rogi has been kept, so there should be restricted entry for that room or no entry for that room. Okay, and that room should be cleaned twice or thrice daily. That room should be cleaned twice or thrice daily. So that means that room should be under the surveillance of sterilization. So sterilization, all the sterilization methods should be followed. Okay, aseptic measures has to be strictly followed. So what are the unique methods of doing these aseptic methods, following these aseptic methods in Ayurveda classics? So, okay, so what they say is burning the fire and sprinkle it with the water to keep away the microorganisms. So what they say is that some of the drugs which are having Tishna, Ushna quality should be taken, and it should be burned inside the room, in a corner of the room. So we have to make such arrangement that some of the wooden pieces of the Vanaspathic drugs, Ayurveda drugs, like these Tinduka, etc. So that should be kept there and cut into small wooden pieces, and then it should be burnt. So now when it is burning, there will be production of the fire, that is, the Agni will be there, and Ayurveda says that Agni is the destroyer of everything. That means Agni will destroy everything and purify everything. Agni is also purifying the gold, isn't it? Similarly, Agni is the one which destroys all the krimis. Okay, so that Agni should be kept on burning, so that temperature level be high in the room, and none of the microorganisms can survive there. Okay, so temperature has to be kept high by burning this the herbs. Okay, so this will keep away the micro and macroorganisms both. Macroorganisms are many of the vectors, for example flies, house flies, sandflies, etc. So these are some of the vectors which can spread the disease. Therefore these micro and macro organisms both will be controlled by the simple method. Okay, you take the herbs of Ayurveda which are having Ushna and Tikshna property along with a strong aromatic smell, and in the corner of the room where the patient has been kept, keep on burning that. So it will maintain the temperature of the room, and that temperature is not conducive to the organisms, so it will impart a anti-infective property, disinfectant property, macro and microorganisms will be burned down. So many benefits will be seen by a simple method. This is one of the important method. Another one is a lamp should be lit with the mustard oil, and it will keep the room illuminated and removes the moisture. Another simple method, they say, a patient where the Graha Rogi has been kept isolated, in that room you have to continuously burn a lamp which is filled with the mustard oil, the Sarshapa Taila. Now Sarshapa is considered as one of the Rakshogna drug also. Okay, so Taila will be prepared by this Sarshapa, that is Sarshapa Taila, and its lamp should be lit. And there are multiple benefits. One is Rakshogna benefits of that particular drug is also there, because it is a having such properties, anti-infective properties. Number one. Number two, it also gives the illumination into the room, especially in the night hours. It gives the illumination to the room, and it also remove the moisture. Okay, it also remove the moisture. Usually, when we lit on some other tungsten bulbs or some other bulbs, usually, so what happens? There will be illumination, and but the air become dry. Okay, so suppose to maintain the temperature, if we put on the heater in the room, usually what happens, all the temperature is maintained, the room become dry. Now the benefit with this mustard lamp and all, there will be illumination, there will be removal of the moisture from the room. That means it take away the extra humidity of the room, but still the air will not be dry, because dry air and dry oxygen, these are quite dangerous actually, especially for the newborn baby. So now this lamp lit with the mustard oil, although looks like a very simple method, it has got multiple benefit. It keeps the rooms illuminated, it removes the humidity, it maintains the that means it will not cause the dryness of the air. Okay, and it also, most importantly, it imparts the anti-infective properties, because sarsaparilla itself was one of the Rakshoguna drug. Another important method which has to be followed in the isolated room is a ash prepared with the flowers, seeds and leaves of different drugs like yava, tila, sarshapa will be spread. Now, the leaves of these drugs has to be taken, tila or bija, leaf or any the stem material of yava, tila and sarshapa has to be taken, and it has to be burnt, and its ash will be prepared, and this ash will be spread on the floor of the isolated room. Okay, because these drugs are again having disinfectant and anti-infective properties. Apart from that, the child which is isolated, Graha Rogi which is isolated, so he should be also given lepas externally. That has to be given lepas externally. So that means although nobody is coming there, but still he has to put the lepa all over the skin. The reason is to prevent the spread of infection through the bite of the mosquitoes and to overcome the bad smell. Two possibilities are there. When we talk about Graha Rogi, always in the Graha Rogi, bad smell is explained. That means different Graha Rogas, different types of bad smell is coming out of the body. So lepas may be there to control this particular bad smell, number one. Number two, or lepas may be as a repellent for this mosquito and other vectors. Okay, so this prevent the spread of the infection from the room to outside. Okay, or even from the outside, any infection is coming into the room and into the skin of the person, it will be prevented there. So such a beautiful explanation, 3 or 4 methods which are explained that one has to follow inside the isolated room. So that is one of the best and simple and cost-effective method of infection control. So this is all about isolation of the room. In the next class, we will discuss about the rules and regulations which is given for the attendants who is taking care of this particular person who is residing inside the isolated room. That we will see in the next class. Thank you very much. We will meet again. Don't forget to subscribe my channel, and also please give your valuable comments. Thank you.